Welcome back to another sports massage therapy education video. Today we're going to be looking at the Apley Scratch Test. So we're testing for shoulder mobility. So we're going to want to do this on both sides. So if I can get the client to bring one arm up and bring in the other one around to the back. So what we're looking at here is we've got internal rotation of the shoulder, external rotation of the shoulder, and also thoracic mobility, thoracic extension, shall I say, of the spine there. So you can see here, the fingertips touch, that would show excellent range of motion there. So this is actually where we want our clients to be. So for example, if they were around here, that would be terrible and we would need to start looking at doing some shoulder work to release those muscles up. Literally where they're sitting there, no issues at all. So what we're going to do is test the other side now. We're going to look for differences. So yes, we look at this and again, already touching absolutely fine, but it was a little bit more of a struggle to get this one round here with that internal rotation of the shoulder. So albeit there probably wouldn't be a great deal of work I would want to go into, but I would still want to look at doing some kind of work in there to test that shoulder mobility after we've done that. So you'd want to get in, just really kind of just loosen everything off, go with all your techniques and then retest to see if we can improve that range of motion through that shoulder there. And that is a wrap on another video. So if you want to know a little bit more about the shoulder, in 2 days, I'm going to be dropping a video on how to loosen and improve that range of mobility around the shoulder. So if you've tested your clients and they have got that limited range of motion, stay tuned because in 2 days, we're going to be dropping a video to help you with exactly that problem. So as always, if you've liked it, feel free to like, comment and subscribe. And as always, I will see you in the next one.